Good morning, everyone. I hope everybody's having a good Saturday so far. It looks like the sun's out and it's going to be a pretty day, hopefully. You'll notice I've got a whiteboard here, so we're really going to get a little nerdy today, so I'm excited about that. So today's topic, we're going to talk about how to examine some of the studies and the scientific information that everybody is seeing and being exposed to in social media and on the news. So we're going to get to that in just a second. But first, I wanted to answer just a couple of questions that I got and talk about some general updates from the last week or so. So I'm going to do the questions first. The first one is about someone who has tested positive for coronavirus and had the illness and was either asymptomatic or did not have very many symptoms, but they've recovered and they're doing fine. How long is their immunity good for? So this is a good question, and it's one that we still don't have a lot of answers to. We do think in general that we display immunity at least for several months, but this is one of those questions that until we have a longer time with this virus, I know it seems like it's been forever, but really over the last 6 to 8 months, when we look at study and information, when we're trying to learn things like that, it really does take a lot longer for us to really know that information in more detail. So some of the recommendations that they've come out with, for example, in school settings and for people who have been exposed to a new case of coronavirus after they themselves have already been infected. Right now, those guidelines are suggesting that if you're within 3 months of having been infected and you are exposed to a new case, then you do not have to quarantine. If you are after 3 months from infection, then right now, based on what we know, the recommendation would be to quarantine and isolate again if you are exposed to a new case. So that may help answer some of that question in particular. Right now, we're kind of operating on a 3-month assumption that you should kind of be in the clear and safe from reinfection at that point. And that's what we know so far. So I hope that answers that question. The next question on the list is about filters, using those in conjunction with your cloth face masks. What types of materials can be used and how long can you use them? How should you clean them? When should they be replaced? So this topic, there's a lot of different material that we're seeing used for different face masks and things like that. In general, with some of the information that we've seen more recently, we do think that most materials that you're using, especially just the regular cotton face masks, do offer pretty good protection. And so you can feel pretty comfortable wearing a regular cotton face mask for most of your activities. A lot of people use some of the HEPA air filter type products for putting in an extra layer of protection within the mask. I personally, when I'm in clinic, most of my encounters, I will wear an N95 mask and cover that with a cloth mask so that I can use my N95 mask a little bit longer to keep it from getting soiled or dirty from the outside. So the time frame on when to replace things like that can sometimes be a little bit difficult to say for certain. Definitely if it gets wet or moist or dirty with anything, you definitely want to throw that away and replace it. If you have a material that is maybe okay or amenable for washing it, then certainly doing that frequently, at least a few times a week. And then your cloth masks, you do want to wash those frequently as well. Definitely if they get wet or soiled with anything, you want to replace or wash those and be sure to keep those clean. Usually hot water and regular detergent can be handy. If you're really concerned, you can do a type of bleach solution depending on what your pattern of your mask is. You don't want to ruin that because they're becoming quite the fashion statement. But in general, those are kind of going to be the basics of using filters or an N95 mask or another type of mask in conjunction with a cloth mask. And most of those with what we're seeing are protective and doing the trick for what we want them to do. I've got one question here that's already popped up that I'll go ahead and answer. Have I seen any cases of reinfection? And that there are definitely some cases and occurrences of reinfection that we are seeing. Right now, based on what we know, it does seem that the reinfection rate is fairly low. So we're not seeing that tremendously frequently, but it is definitely something that's a possibility. That kind of ties into the immunity aspect of us not knowing 100% how long our immunity is going to last with this specific virus. The coronavirus itself, from what we know so far, does not seem to mutate quite as much as we see from the influenza viruses, for example. And so we do think that over time, hopefully, we're not going to see as much reinfection potential or recurrence, because once you do gain that immunity, as long as we are able to keep it for some time, we think that most people are going to be fairly protected from that. The next question on this from the live stream is, are there any cardiac effects or damage in the long term? So this is actually something that Dr. Dobbs spoke about in the weekly update this week. We do see with coronavirus and some other viruses as well, there is definitely a potential for what we call myocarditis, which is an inflammation and infection where the virus gets into the cells of the heart and can cause an inflammation and basically an illness in the heart itself. Sometimes this can be mild and short-lived, but for many people, this is something that does have the potential to have long-lasting effects. So in general, for people who have myocarditis, that's something definitely in the short term. That's where we see that they have some problems with difficulty breathing. Sometimes they may not be able to get blood to all of the places that they need it to go, and that can certainly cause problems with getting oxygen to the right places and getting fluid and other nutrients and things to the right places. So that's definitely a concern in the short term. And then we have seen and maybe heard some case study type reports of people who are still having difficulty or problems weeks to months after from a myocarditis effect, which can remain and keep the heart kind of weak. And so there are some recommendations out there, especially for athletes, that we don't want them returning to a lot of strenuous activity that's going to put more stress on the heart, because there may be some long-term effects or damage that can occur related to that. So those are good questions. Still some things that we're looking into and learning about, but definitely good things to consider, because it's definitely a possibility. So moving on to some of the general updates for this week, just a few reminders. For the most part, what we talked about last week with some of the quarantine and isolation guidelines are the same. So just to kind of re-emphasize those, if you are a person who has tested positive for coronavirus, then that means that you must isolate yourself from anyone else and be, if you're in your home, try to confine to one room, use different bathrooms and things like that from other people, wear a mask around others at home. Definitely not leave the home or go out where you may expose anybody else. And that isolation time frame now, as long as your symptoms have improved and you don't have fever for at least 24 hours, then at 10 days you are able to return to normal activities. Now, if you're still having symptoms or you are still having fever, then you do not need to return to normal activities. You need to remain isolated and talk about what you should do really with your doctor. Now, the quarantine guidelines, which is for people who have been exposed to a person in close contact within 6 feet for 15 minutes or more, those people that have been in contact with a positive person, the guidelines are still that you quarantine for 14 days. The reason for that, and the reason that the time frame is longer, is because we have seen cases of people who have been exposed and test negative around the 7-day time frame, and then up to 14 days later they can still become positive and may have been shedding the virus that whole time, or at least part of the time. And so returning to normal activities around others is definitely a risk in that scenario. So we want to be very mindful of that. So again, if you've been exposed to someone, it is still recommended that you quarantine for 14 days. And just because you have a negative test during that time frame does not mean that you can return to your normal activities before that 14-day time frame is up. So keep that in mind. Topic on flu shots. Again, those you want to make sure, our clinic has not yet received our shipment. There's some other places that have not, but we're definitely recommending that you get those starting now, and hopefully get those done before the end of October. So definitely be on the lookout and add that to your to-do list, and don't forget to have that done. Now, we're going to move on to some of the information on looking at studies and how to evaluate some of this information that everybody is seeing, and trying to understand the huge amount of information that we're getting. I'll preface this with the fact that biostatistics and studies was not my strongest suit and subject in med school, so I'm by far not the absolute most expert person to speak on this topic, but I think I can give you a pretty good general idea of how to look at things and some of the things that are going to apply to really what we're seeing with coronavirus specifically. So I've got on here my little whiteboard. I think you can hopefully see. We're going to talk about, I've talked about the Dear Pandemic page several times. That is kind of making all of this information easier for us to understand. And they have been really helpful, and I've been sharing some of their information. So I really still encourage you guys to check out their page at Dear Pandemic, because I think they've got some really helpful information. So we're going to start with their 3 C's that they've got here, which are comparison, chance, and context. So this is how they kind of recommend looking at studies and their information. So when we look at studies in general, we want to try and do all of our study information with what's called a randomized controlled trial. So that means having a treatment group who is getting the treatment, medicine, or vaccine that we're trying to study and determine how effective it is and how safe it is, and then a group that is not getting that or getting what's called a placebo. So that's the most ideal type of study, is that we have 2 groups, one that is a comparison group and one that's what's called a control group. We want those people or participants in the study to be a large number, and we hope that they're a diverse group of people so that we can get a good representation of what that's going to look like in the real population. So that's kind of the general layout. So that's where comparison comes in. The first one on the list is how controlled is the comparison group. So that basically means in our treatment group that's getting the treatment drug or the vaccine, whatever it is that we are studying, that intervention aspect, compared to the placebo group, are they alike in their age, their race, their sex, all of those things? Do we have a good control of making sure that those things are equal? So we want to make sure that the comparison between those two is pretty much equal and the same across the board. So that's where comparison comes in. Chance is if there is random chance possible. And so there's always that potential and possibility. This is kind of like looking at things that can just be a coincidence. There's always that possibility. And so the way that we kind of control for that is that we try to have large sample sizes, which means just large groups of people, so that we try to eliminate any chance of a random occurrence affecting the data. The other thing that plays into that is also if the study itself is easy to replicate and get the same results. So if we have one study that we do, for example, on a medicine, and it seems like it works, and we know that it's safe, then that's just one study. And sometimes, depending on how many people were in that study, that may or may not give us good information about if it is truly going to be safe when it gets sent out or distributed to the population as a whole. So we want to make sure that if we did that study again, that we could replicate it in the same way and get either the exact same or very similar results. So that's one thing that's important as well. If you have studies that you can't do that with, so you can't replicate and get the same or a similar result or outcome, then it's very possible that the first study could have just been due to random chance. So that's one thing that you want to examine when you're reading through some of the studies, and if you have ones that it's replicating another study from before, then that gives it a little bit more strength in that result or what you get as the outcome. The last one here of the 3 C's is the context. And so, does the study setting generalize to the context that we are interested in? So, a lot of what we're talking about now with studies obviously relate to coronavirus. One of the things that's on a lot of people's minds are the vaccine studies. And so, what this would apply to in that scenario are the study settings where we're testing the vaccines. Do those populations of people who are being tested in the studies with the vaccine, do they look similar to our population as a whole? And so that's where some of these other things come in. Or do they have, adults? Do they have males and females? Do they have children? We want to make sure that the population that we're looking to give vaccines to, we want to make sure each type of person and individual and patient that we may administer the vaccine to are represented in a good number in that vaccine. So hopefully that gives you a little bit of an idea of some of the things to look for. A lot of the things in study reports and journal articles will talk about this in the discussion section. So if you're actually reading a scientific article, they will sometimes discuss some of these things just to help people understand, where they may have seen some fault, or if they feel like some of these things were represented very strongly, then they'll usually discuss that so that you have some idea of if the study meets kind of these general criteria that you want to look for. Now, one thing I'm going to touch on as well, because rapid tests is another thing that has become a big desire for people. And so a lot of people want to get the rapid test so they kind of know their result. But there's a few things to consider, especially with a new test like this that hasn't been around for a long time. So kind of the comparison here are rapid strep tests. And so we're going to kind of use that and compare. I'm going to try to give you guys some examples to help you understand that a little bit better. So when we're looking at things of that nature, let's see if I can get this where you guys can see it. Is the specificity and the sensitivity. So these things, if anybody's in med school and looking at this, I have to look it up almost every time I try to explain it to somebody. So the specificity of a particular test is really the proportion of people who do not have the disease, so COVID, for example, and they test negative. So people who do not have it and their test is accurately negative. So a person in this scenario with a positive test almost always means that it's an accurate positive. Specific tests with a positive result rule in the disease. So when we look at these types of tests, these are more of our confirmatory tests because they are able to very accurately say that the disease is there. And so that means they're good at detecting, for this example, the viral particle with accuracy. So the sensitivity is the percent of people with disease who actually have the disease. So this is a good screening test. And so generally screening tests are ones that we use more widely if maybe we are not sure, or we're maybe looking to try and look into a large number of people and find cases. So these you can have some false tests more often. So a sensitive test with a negative result will usually rule out the disease. And so that means that tests that are sensitive are a little bit better at saying the disease is not present as opposed to if it is present. Now, the one caveat to these two things is this right here, that we must take into consideration the clinical scenario. And so that's one thing that always has to be considered. So just to use these two examples with the strep test, for example, the strep test is both a good, because it's been around for so long, it's both a sensitive and specific test. So it's a pretty accurate test one way or the other. But in general, we do sometimes recommend that if you have that test and it's negative, but we think that you really may have strep, so your tonsils are swollen, you have a lot of throat pain, maybe there's fever, and your throat looks like strep, then we're going to do a confirmatory test if that initial test that we've done is negative. So when it comes to coronavirus and these rapid COVID tests specifically, we do think they have about an 80% false negative rate. So for about 20% of tests, the result may not be quite as reliable. So when we use our clinical judgment and the clinical scenario to look at that and apply it to those tests, in someone who is sick, they have fever, cough, shortness of breath, and they, for example, get a negative COVID test, then that's a scenario where that may be one of those false negative results, and we want to do a confirmatory PCR test, which, yes, it may take a little bit longer, but that's where the clinical setting and the symptoms really should inform the decision of doing a test to confirm, and be sure that that rapid test that's not quite as sensitive as the PCR test should be done to make sure. Now, if I have someone come in and they were maybe had a small cough, or they had a low-grade fever that we wouldn't really consider, or for example they're needing to do a test because they're having a procedure done and they need to know their COVID status before doing that so they don't have any symptoms, a person like that who gets a negative rapid test, I'm probably going to trust that result because they don't have the clinical scenario to make me really suspicious of that. So hopefully that answers some of your questions and maybe gives you a little bit more insight in how to look at some of the information that we're all seeing in the news and the media. A lot of the tests and the studies that we have now that we're getting some information from are not yet made up of a lot of randomized controlled trials. So when we look at the types of studies that we're getting right now, many of them are what we call either observational studies, where we're just kind of looking at what happens and we don't really have a specific control or placebo group. Some of them are what we call retrospective studies, where we're just looking back at the information and trying to kind of draw some correlation or find some similarity between people who had the same disease and got the same treatment and compare those to others. And so in general, most of our studies right now that we're getting information from are those. And so those have much more likelihood to not control for the things that we just talked about that are the 3 C's, because they're not designed in that controlled environment. And so some of that information is hard to interpret and hard to say if it's going to be something that can be replicated. And so that's why a lot of this information that we're going off of gives us some idea of where we're headed, but we don't feel 100% certain at saying, this treatment works or this treatment doesn't work. And so when we look at those things, what our goal is really going to be is that we begin to start getting some of the information from the randomized controlled trials that are going on, and hopefully we can compile those into what's called a meta-analysis, which is really kind of the best study type that we have, because a meta-analysis takes a number of randomized controlled trials and puts their data and information together so that we can increase the population size, we can increase the diversity and the variability between patients and people, and use that information to therefore increase the kind of validity, the reproducibility of that randomized controlled trial, and gives that a little bit more backing of being accurate and being able to replicate that information. So as we kind of continue to move through this whole process, those are some of the things that you can look for, and I'll try to post some other stuff maybe in the comments later that can give you guys some good guides on that type of information, because I know all this stuff is really confusing. Like I said, it's never been my strong suit, so it can get difficult to go through sometimes. I've got just a couple more questions here. So one, are children at an equal risk of myocarditis? And I think the answer to that right now is yes. Some of the cases that we're seeing myocarditis being more dangerous can be in those children who may not become symptomatic. And so we may not know that they necessarily have COVID, or they may have a very mild case. And then they could certainly later develop the myocarditis effects, and we may not be aware of it. It may be a little bit of a delayed response. So that's where, in someone who has had COVID, especially a child, you kind of want to limit their activity and not do anything that's too strenuous, especially a lot of things that are more cardio or exercise where they're really pushing their system more, because they certainly could see some of the complications from that if they have a mild case of myocarditis and then they stress their system. It could certainly make things worse. So the risk is definitely there. Fortunately, we've not seen too many complications yet from it, but there have been some reports of some young, especially I think more teenage years, who have gotten COVID, and myocarditis has definitely been a big factor in their course of illness, and unfortunately in some cases resulting in death. Last question here. Where should I go to find articles that are reliable and go through a peer review process? So this question comes from my sister. She could probably answer it better than I could. But there are a few ways to go about this. So we, as physicians in general, have some access to some scholarly websites. A lot of our journals have good peer-reviewed articles. And so a lot of the times, and especially now, I think you can find those easily on websites. Google Scholar is a good way to search for some of those things. You can certainly use resources from libraries to find those things, but most of the medical journals that you'll see, so the JAMA journal, which is the Journal of the American Medical Association, a lot of the Infectious Disease Society journals, our Academy, for me, the Academy of Family Practice has good peer review journals. So most of those specialty societies that exist in the medical community, all of their papers and studies and articles go through a really thorough peer review process where multiple people examine their data and information, and usually they don't get the article published unless enough of those people have reviewed it and feel like it's been a good study and is accurate. So those should be some good places that you can find that information. I know that the Dear Pandemic page that I've mentioned before, they do have a website now where they're kind of compiling all of their posts, and they usually always reference their source articles. So that's another good place that you can find things as well. A lot of the times if you search for something and you find an article, they're also going to have subsources that are cited, and you can always look through those as some other sources of information. So I know that was a boring and a nerdy topic, but I hope that was helpful for you guys. Always let me know if you've got questions, and I'll be letting you know what the topic for next week's video is. But if you have any ideas, definitely send them my way, and I hope you have a great weekend and stay safe.